Good evening, I'm Dennis Ward, and this is Face to Face. Our guest this week is Diane Redsky, the Executive Director of Mawi Wichita Center in Winnipeg. Diane has worked to address the many issues facing Winnipeg's Indigenous community in the areas of health, justice, education, and social services. She's a strong advocate for Indigenous children's and women's issues. Diane, thanks so much for being with us this week on Face to Face.
Well, thank you for the opportunity to be here, Dennis.
For our national audience, some may not be familiar with Mawi Wichita, which translates from Ojibwe into the phrase, we all work together to help one another. Can you give us just a brief overview, I guess, of the work that you do?
Sure. So the Mawi Wichita Center was established in 1984 by a number of Indigenous leaders who had great concern, and rightfully so, about the care and protection of Indigenous children in the child welfare system. And so back in 1984, they gathered around a kitchen table like many people do, our community does, in order to give birth to really special initiatives. And so in '84, they got together to come up with a community-based response to the reasons why children are coming into the child welfare system. And so since then, since 1984, the Mawi Wichita Center has really become the grandmother of community social service organizations in Winnipeg. And we offer a variety of family resource support services for urban Indigenous families living in the city of Winnipeg. And so that looks like a whole bunch of locations that are community-based, where there is in fact one of our locations that's called the Living Room of the North End, that are welcoming places where there are a little bit of everything to everyone. And then we work in partnership with the child welfare system, and we offer services in foster care and in youth group care. So we have an opportunity in the event that children need to come into the child welfare system, that the Mawi Wichita Center, we want to play a role in caring for them so that they maintain those strong connections to their family and to their community. And then we want to invest in our future, so we have a pretty big youth department that is led by Indigenous youth who are doing incredible work right on at the community level, at the grassroots level, of building their own leadership in a supportive environment. And then the last area of work that the Mawi Wichita Center specializes in is honoring Indigenous knowledge. And this is really critical in our work because we have known there's a very special resiliency about our community that makes us, has always made us strong, and it is those Indigenous knowledge ties to our culture, our ceremonies, our language that has really, we've been able to survive 500 years of colonization, and we continue to be leaders, and we continue to make incredible changes and contributions to Canadian society. And so we want to honor that Indigenous knowledge through a variety of different programs that allow us to be the leaders in child welfare, allow us to be the leaders in training and development. And so we have very special cultural learning center. We offer Aboriginal Head Start program, as well as Spirit of Peace family violence prevention programs that are really reviving that those inherent values of how we care for one another, so that we are the ones that are leading the change, and we are the ones that are protecting our own community members, as little as they are and as old as they are. And so we focus in on ensuring that we are investing into the future, as well as honoring and caring for our past, and acknowledging where we are today and where those opportunities lie to really be deep-rooted in those relationships that we have with the urban Indigenous community here in Winnipeg.
Diane, that's a lot of great work, obviously, and a lot to talk about, but I'd like to start with a new initiative in Winnipeg called the Village Project. Recently, there have been urgent calls, as there often is, for action on ending homelessness in Winnipeg. How does the Village Project fit into that?
Yeah, the Village Project is a really special project for our urban Indigenous relatives who are homeless. And what the Village Project does is that it takes the issue of managing homelessness, so going beyond the food and the shelter of what people need, and we certainly need those resources and appreciate those organizations stepping forward and providing food and shelter to our relatives who are homeless. And we wanted to have the Village represent what it's going to take for our relatives to move beyond and address the root causes that is a reality in their lives, that created homelessness in their lives in the first place. And so the Village Project is that opportunity to bring together our knowledge keepers, our ceremonies, our culture, our language, and create that safe space for our relatives who are homeless so that they can take those really important, vital first steps on their healing journey, which can be very scary for people if they are not in a supportive environment. And so the Village Project is that it will be that safe space that they will be able to come, that they will be able to have access to our knowledge keepers, to our ceremonies, have a safe place to close the door and know that they're going to be safe, and know that they are going to be supported on their healing journey. And they're going to be supported on their healing journey by knowledge keepers, by really kind, understanding, non-judgmental, trauma-informed people who honor harm reduction. It'll be low barrier for that. They're supported in that type of environment so that we can really address the root causes and of the reasons why our relatives are homeless in the first place. And we also need to ensure that we are acknowledging those systems that play a role in creating and sustaining the people to be homeless. And so this is a real opportunity for us as well to show how we as a community, we can care for our own, we can create those healing opportunities, and we can change lives. We can save lives, we can change lives, and we will do that through the years and years and generations of resiliency that our elders and our ceremonies have taught us, and pass that on into the village in a very small geographic area, so that we are concentrating fully on supporting people to take those first really important, vital steps on their healing journey. And so we are very excited about the opportunity to do that. And this as well, and I want to acknowledge the young people that came forward and they operated a mini village, literally, right beside the location where the village is going to be over the 2 weeks when it was minus 40. Mm-hmm. We had our young people, they set up the teepees, and you know, the incredible stories that came out of that, which often I don't think any of them made it into media. That was a really powerful experience. We were hearing stories and experiences from people who were, because of that village, they knew that they mattered, which is critically important in your first step on your healing journey. But also there is like 2 or 3 people who went on to detox from the village. So they started accessing those services. There was a couple of women who were actually missing, and people were looking for them, that were found in the village. And so this whole community coming together to support one another with our knowledge keepers, our young people, and the community coming together is really those are natural ways in which we respond, in which we care for one another. So it's a perfect example of how the village can replicate that kind of spirit within the land and within how we care for one another to change lives, save lives, and really build a community and show that from our homeless relatives that there is a community waiting to support them, to help them on their healing journey, that we haven't forgotten about them.
Great stories to hear, for sure. This would be a 22-unit communal living complex, but we know about 80% or so of the people living on the streets in Winnipeg are Indigenous. Is there any sense of how many units are actually needed out there?
Oh, there are hundreds, and there are various stages and various levels of homelessness, from completely unsheltered to a variety of different couch surfing where it's not safe. And I would say there's a housing crisis in Winnipeg where we need more affordable housing. We need a guaranteed livable income, and so that we stop perpetuating all of those and continue those barriers for people to get out of situations that they're in. Oftentimes, it's difficult to get out of these systems that just we can't catch a break to be able to rebuild lives. And so this is a real opportunity to identify those systems and to be able to work with those systems, to start switching those systems around so they start working for people in a meaningful way, rather than having systems continue to perpetuate the creating risk. And and there's not just one system that does that. There's a number of systems, and I know by talking to many leaders within those systems that they also want to change too. They want to be more effective in not only the work that they do and the policies they develop, but also the funding opportunities that are really needed for Indigenous-led organizations to lead the healing of our community.
Diane, much more to talk about here. We just have to throw to a quick commercial break, but we'll continue the conversation here on Face to Face, coming up with Diane Redsky. Welcome back to Face to Face. Our guest this week is Diane Redsky, the Executive Director of Mawi in Winnipeg. And Diane, we've been talking about housing, and just wondering, how has the COVID-19 pandemic affected people's housing situations?
Well, there's a number of concerns with housing when we already had people pre-COVID not in housing situations where these are safe places. And so there is also the reality of people being on waiting lists and people already being in homes that are not adequate, whether they are operated by Manitoba Housing or whether they are operated by the private sector. And so we had to put a lot of advocacy into ensuring people were not evicted from their homes. And sadly, since that has been lifted, we have had to support multiple families with landlords exercising evicting people from their residences. And so people are now having to disperse within their families. People are couch surfing. People are looking for other housing. But if other housing doesn't exist, then it doesn't exist. And so there really isn't, because of the housing shortage, there isn't a supply to choose from. And when you do have choices, you often have to pick between worse and something that's even more worse. And so there is that is sadly the reality that COVID has only magnified the inequality around housing, inequality around food security and income security. So what the reality for many Indigenous families living in Winnipeg is that you are worse off today than you were before COVID. And so we are barely keeping up as an organization, trying to make ends meet for people and just their food security. We have now over 160,000 hampers have been delivered to families to their doorsteps because of COVID and not being able to go to the grocery store, not being able to afford food as well, because many people relied on organizations like the Mawi Wichita Center and many other community-based organizations for their daily food and for their daily advocacy and for their daily place to feel valued and supported. And all of that stopped a year ago. And so there has been organizations like Mawi and many others who have been trying to keep up with the demand of what our community needs, right from food to housing to incomes, security, and we're also trying to ensure that we are addressing the violence that is happening within homes, the mental health that this is directly caused, our young people and our elders, and trying to keep up with creating those opportunities and bridging those gaps and addressing those barriers. And if you don't have a safe place to live, how do you go beyond planning anything else if your day-to-day survival has been interrupted by not having a home? And so this is a reality that many community organizations like the Mawi Wichita Center face in trying to support families. And we really hope that the new normal, some of the things don't come over from the into the new normal, that we really have to address the food, housing, and income insecurity, inequality for urban Indigenous people living in Winnipeg. Like, it just has to be a better place. We all need all hands on deck, including our leaders and our partners, to be able to be working towards that goal, that the new normal can't be what it was before, where it was just okay to be poor, and we really need to go beyond that. And we know that the capacity is there. COVID has also taught us a lot about, when things can happen and people want things can happen. If people want things to happen, it can happen in short notice and in short order. And that includes organizations like the Mawi Wichita Center. We went from operating a community care center, welcoming hundreds of people into our doors every day, to the next day setting up a food hamper program. And so there are many organizations that have had to do the same, and we can meet people's needs. We can change on a dime like many other organizations can do, and we need to be able to work together so that next year or this year or whenever we can have some hope around what that new normal will be, that it will look completely different for our families, and that we can really change as a society, that we need to be caring for our most vulnerable first. It's a reflection of who we are on how we care for the most vulnerable, and this is a real opportunity to show it and to have all hands on deck. And so I'm hopeful that this is one of the teachings and one of the outcomes that come out of COVID, is that we will have a better place for our families in Winnipeg.
Dan, I'd like to switch gears to something that's no doubt on the minds of many of us this week, and that's the missing and murdered Indigenous women and girls. And we're still waiting on a national action plan. You sit on a working committee on this. How are things coming with that?
Yeah, and I'm really grateful for the opportunity to be involved with the Missing and Murdered Indigenous Women, Two-Spirited LGBTQIA National Action Plan. I'm currently chairing the urban sub-working group of the National Action Plan. So there are a number of working groups that have been working essentially for the last year, dedicated every week to come up with plans that are really going to represent what systems need to do, what grassroots community, and how do we elevate those grassroots initiatives that have been happening across the country. So we have been, it's an incredible group of leaders that have been involved. It's a really big systemic issue. We didn't get to genocide overnight. It happened over a long period of time, and so the leadership and the work that has been done since last year to put the components together in a framework for the National Action Plan to really create those common tables has been going really well, and I'm very happy that the group that was assembled is doing incredible work in that area, and we are all working towards coming up with a National Action Plan that is going to represent the voices, honor the families of missing and murdered Indigenous women and girls and Two-Spirited LGBTQIA, And it will be a representation of all of that. And so we are have been working weekly and dedicated to coming up with those solutions, those grassroots, community-based, and system solutions to stopping and preventing this genocide from continuing to happen in Canada. So we are planning for June 3rd, like a June-ish, of informing Canadians of all of the work that has been happening. Province and territories are also, and cities across the country are also doing their pieces of it as well. And so it'd be great as we near the second anniversary of the National Inquiry that we will have a really unique and important opportunity to share all of that incredible work, because it is going to take everyone to start reversing and start addressing some of the reasons why we are currently in this situation where there is way too many Indigenous women and girls and two-spirited LGBTQIA being impacted to this day. And that needs to stop, and that will require a lot of organizations working together, a lot of political leadership working together. And I actually have not met anybody through this whole process that is working against that. So it's been an incredible honor to be able to be part of that process and see firsthand all the leadership that is, and all the heart medicine that is going into ensuring that we are doing things differently moving forward, and things will change for Indigenous women and girls and two-spirited LGBTQIA in Canada.
Many people certainly will be looking forward to that update
Yes.
in June. Dan, we just have to step aside for another quick break, and then we'll continue the conversation here on Face to Face. Welcome back to Face to Face. Our guest this week is Diane Redsky. Diane's a Governor General's Award winner, just recently awarded as a Manitoba Women Trailblazer. High honors for sure. Diane, I think the last time I actually saw you in person, we were in Ottawa for what was then the emergency meeting on child welfare. Almost 2 years later, there was optimism at that meeting. How are you feeling 2 years on with Bill C-92 and where we're at with the child welfare system today?
Well, I think it's, from my understanding with Bill C-92, is that it is certainly from the community level. It's been slow in coming, and that being said, we know that any kind of system reform, it is a step absolutely in the right direction of when you have the decision making and you have the power, you can make change. And so Bill C-92 giving that control and power to First Nation communities and to our leadership, to our Indigenous governments, is the right direction to be going into, because we will see positive impacts. And while I understand why that can be a slow process, and certainly looking forward to it at a community-based level in being part of building those solutions so that we can maximize on the voice and the role of urban Indigenous people being a part of that in a really meaningful way.
Dan, there was so much more we could have talked about. We're out of time. I do want to just make mention, though, that Mawi has helped and facilitate returning more than 300 children to their families.
Yeah.
So, Diane, thanks so much for your work, and thanks for being with us this week.
Thank you, Dennis.
And that's all the time we have. You can catch up on any episodes you may have missed by visiting our website, aptnnews.ca, and find this and other episodes as a podcast by visiting aptnnews.ca/face-to-face podcast. I'm Dennis Ward. Thanks for tuning in to Face to Face. Have a great night. We'll see you back here next week.